We're going to quickly move on now to our big story that continues to be the fallout of the coronavirus. One new case in Delhi's national capital region. The total in India now at 30. Primary schools in Delhi have been shut till the 31st of March. So children up to class 5 will not need to go to school till the 31st of March. The India-EU summit has been postponed. Prime Minister Modi will not travel to Brussels. The major concern, Indians in two epicenters in Iran, Tehran and Qom. There are plans to try and get them out. Sikkim, meanwhile, has stopped issuing entry permits to foreigners as a safety measure. So let's just also continue to look at the India scenario. 30 cases reported so far in India. Let's pull up that map. 3 cases in the national capital region. It was earlier 2. It's gone up now to 3. In Delhi, there are also 14 Italians and 1 Indian who was with the group. These were 14 Italian tourists in a group of 23, I believe, who'd come across and traveled Rajasthan extensively and contracted the virus. 2 cases of these Italians, the individual who had the illness first and his spouse, they remain in Jaipur. 6 cases are there in Agra as well. These Agra cases are linked to that one individual who picked up the coronavirus in Italy and then traveled to India. These are his relatives. In Telangana, 1 case has been reported, but 3 cases have been cured. In Kerala, these were reported earlier on as well. So let's continue to move on, bring you some more details of these patients. 2 Delhi patients had in fact traveled from Italy. 6 contacts of the first Delhi case were reported. 1 patient in Delhi has a travel history from Iran. 1 patient in Telangana has a travel history from Dubai. 16 Italian citizens have a travel history from Italy. 1 Indian driver accompanied these Italian tourists. 3 Indians, as I mentioned, discharged after getting better. But let's take a look at the overall numbers around the world. The red areas are where it's been particularly bad. Remember, Hubei province in China is where the coronavirus broke out. 95,748 cases around the world, including China, which has the maximum number of cases. 3,286 deaths. But look at that green number, and this is hope, where of that 95,748, 53,423 have been recoveries. People have gotten better. They're out of centers. They are, if they were there at all, they are okay. The next statistic is the cases where the maximum number of cases, where we've seen nations with the most cases in the last 24 hours. There's been a jump of 141 in China, a jump of 587 in Italy, 586 in Iran, and 467 cases in the last 24 hours in South Korea. So these countries remain a matter of huge concern. The nations with the most deaths thus far, these are the overall numbers. China, we've reported 3,013, followed by Italy at 107. The numbers in Italy have gone up substantially. Iran at 92. Remember, lots of Indian students, both in Iran and in Italy. And in South Korea, the death toll presently stands at 35. So that's the global situation at the moment. Let's keep playing out these points, these graphics, just to give you an idea of what the situation is. Now, this is new information coming in of fresh cases being reported. The first case being reported in South Africa. A lot of people were saying, why no details about the spread in Egypt? Has there not been any spread? In fact, 1 case reported in Egypt as well. 2 new deaths reported in France. The total number of people in France who are now dead has gone up to 6. 107 is the death count in Iran at this stage. These numbers keep fluctuating slightly. The numbers in Italy also up significantly at more than 100. In the United States, the death count has risen to 11. The United Kingdom now has as many as 90 cases. 400 new cases have been registered in South Korea in just the last 24 hours. So that's the overall situation that you can see across the world. Well, let's just go across to Mr. Alphons now, the senior BJP leader who joins us now. Thanks so very much for being with us. Mr. Alphons, one of the concerns which has been raised is passengers not being screened that apparently we should have screened more people coming into our airports earlier on, and that there's also the concern that the symptoms sometimes show up 14 days later, so what's the point of thermal screening passengers at all? You won't really catch very many of them. What are your thoughts on this?
See, the Honorable Prime Minister had taken high-level meetings and he's constituted a ministerial committee, a high-level committee. So I believe the government is doing everything that is necessary. Now, the Honorable Minister also spoke about the screening process in the airport, but I guess there is also a technical issue in this, because you tend to have the symptoms only after 14 days. So even if you are carrying the infection, the virus in your body, the symptoms appear only after, I think, something like 2 weeks, 14 days. In the meanwhile, if you are coming to India, flying into India, and when the symptoms are not visible, how effective would the screening be? So that is a technical issue about which I'm not very sure what the answers are.
And the number of quarantine facilities in the country, do you believe that that's enough, considering the fact that there's every possibility that the number of cases in India might go up?
Yeah, I'm sure, because today we have the coronavirus in 83 countries. About 96,000 people have been infected. There are about 25 million traveling abroad every year, and therefore if you take the calculations over the past 2 months, a very large number of people, a few hundreds of thousands of people would have traveled abroad, would possibly have gone to China and some of these South Korea, Italy, many of these countries which are absolutely vulnerable, where there are a large number of cases. So I'm sure a lot of people have flown in India, tourists have come into India from these places which had the virus, and therefore today we have 29 cases, confirmed cases. I suspect there could be much larger number of cases, people who are possibly infected, but the symptoms are not shown yet.
Right. And so one final question to you at this stage. You were talking about the infrastructure which exists. Do you believe that more needs to be done at the level of states to cater for a potential outbreak there?
No, I think the government is doing everything that is necessary. Now, I think what we really require is very organized system of medical treatment. So I think this is something which every state government has to gear up and do. Like I was watching yesterday, the students in Medical College in Jaipur protesting, saying that the basic facility is not there. Now, I think every state government, see, this is just not something which the Prime Minister or the Health Minister of India can do. I think every state government has to come on board, because health is a state issue. They have to take initiative. They have to ensure that the basic infrastructure is created, it's there, that the doctors and also patients out there are safe, are quarantined properly. So we need to have the necessary protocol laid down. I'm sure the Health Ministry is doing it. I think the Honorable Health Minister of India, Dr. Harshavardhan, had given a very detailed report on what the government is doing. I mean, they are out on a battleground and they are doing everything necessary. Now, the states have to come on board, the hospitals have to do it. I think the systems at the state level, at the district level has to be geared up a lot more, because I suspect the number of cases could be many more.
Right, Mr. Alphons, thank you very much for joining us. Important comments over there that in fact there could be many more cases. This is very much the suspicion at this stage. Well, there are 30 confirmed cases of the coronavirus now in India. Schools at the primary level have been shut in Delhi. More patients are being reported. Joining us now for his sense on where this is all going and what can be done to ensure that we are all safe, Dr. Randeep Guleria, the director of India's largest hospital, the All India Institute of Medical Sciences. Dr. Guleria, thanks very much for joining us. The numbers are now at 30. Is there a real concern that in the interim period this could go up, because all of these patients have been in contact with those around them?
Yes, so there is a real concern, although there is no need to panic. But my concern is that we need to have a good surveillance system so that we are able to pick up all of those who have come in contact with these index cases, and they don't then become the source of a widespread cluster occurring in areas where they have come in contact with other individuals, and there is a sustained human to human spread which is indigenous rather than from a person who brought it from outside and had close contact with someone.
Dr. Guleria, when you're talking about surveillance and of clusters per se, how do we actually survey? Because the numbers would be huge. For example, in the case of these Italians, there was a couple which was infected. 15 odd people around them got infected as well. The individual in Delhi who was infected, 6 members of their family got infected. So the numbers could be very broad. How would surveillance alone work? How do you think it would happen?
So this is the biggest challenge. What we have to do is do a tracing of where they've traveled and whom they've met. Try and develop a system that they self-report if they have any symptoms of fever, cough, body aches. Also, the public should come forward and actually report if they have these symptoms and they have come in contact or have been close to where these people stayed or traveled. It's a big challenge because these are tourists who have traveled to a number of places, and therefore covering all of that will be a huge challenge. But to begin with, that is the only step that we have right now in to contain the infection, because if you don't do that, we will have a huge cluster as has happened in South Korea or in Italy.
In terms of the numbers of beds available in isolation wards, according to the release yesterday, there was approximately 7,532 beds available across the country in 962 hospitals. Is that enough for the moment, or is there any way in which this number can be expanded if required?
So currently what happens is that for the ICU beds, most hospitals have a shortage of ICU beds, and there is going to be a challenge of how do you convert your isolation ward into an ICU and have more and more ventilators, because already in most government hospitals there is usually patients on a trolley requiring a ventilator and you don't have enough ventilators. So the challenge is how do you upscale your infrastructure, your human resources and your equipment. One has a policy in place of how one can convert wards into an isolation ward to manage these patients, how you can redistribute your residents and doctors so that they start managing these patients, and how you can start getting more equipment so that you can manage that. But it's going to be a big challenge, because if we have a huge number of cases, it's going to really cause a strain on an already sort of stretched system.
Dr. Guleria, you make a critical point over here of the absence of, or the potential absence of the required number of ventilators. How does one fix that on a quick basis? Can these be purchased off the shelf in India very quickly? Do these need to be imported? How can that be fixed?
So a large number of ventilators are available with suppliers, and both the government and various hospitals have already started the process of getting additional ventilators, monitors and other equipment required for ICU management. We have to have that in place. We also have to have enough trained personnel, because we have to be very careful that the healthcare personnel don't get the infection. So good infection control measures among those who are managing these individuals who can be infectious is also very important.
And doctor, in terms of screening at airports, for example, how important is that? Because there's the other perspective that you may not have a fever upon arrival, you can pick up a fever in a few days, and you would then need to self-declare. The worry is that people may not necessarily want to self-declare because they'd be put in quarantine.
Correct. So that is an inherent problem, because ideally one should be able to have people who are self-declaring. The airport screening is just one step, and I do agree that if you are in the incubation period, you may sail through the screening in the hospital, in the airport, without having being picked up. But I think it's important that individuals report to the health authority if they have symptoms of fever, cough, body ache, and they've come from a country where an outbreak of coronavirus is happening, and they may be possibly suffering from that. It's not only from their point of view, but from their family members' point of view, because they would then give the infection to their family members who are staying with them.
Doctor, what is your advice to those who might need to travel abroad? Would you suggest at this juncture, and India is by no means the worst off among countries, among many developed and developing countries, we are in fact far better off even now. But What is your word to those who would say need or want to travel to the West, to Europe, or perhaps to Eastern Asia? Some countries you can't travel, some countries you can. What is your word? What is your advice?
So, I think one would try and avoid non-essential travel right now, because as we know, this is an evolving situation. Every day we come to know of new cases at different in different countries, and increase in number of cases in different countries. So, it's difficult to say how things will evolve over the next few days. We are at a tipping point where you may have an outbreak in many countries in Europe, and if that happens, then it will be unsafe for the individual, and he may land up getting quarantined out there if he is in an area where a case has been reported. So, it's better for some time to avoid non-essential travel until the picture becomes clearer.
Dr. Guleria, you would be aware that primary schools in Delhi have been shut down till the 31st of this month. How close are we to a potential shutdown of primary schools in other major cities or states?
So, currently there have not been cases in other cities. One of the reasons why primary schools are being shut down is because one of the ways that the infection can spread is through children in schools. If you have a child who has fever, cough, and he is coughing in the classroom, he will give the infection to children in the same classroom, and they will go home and take this infection, and when they become symptomatic, they will give it to their elders and other members of the family, and this could lead to a huge outbreak. So, to prevent that chain of transmission, schools are being shut down in Delhi so that we do not have a large cluster, as one is worried that you may miss out on your surveillance and you may have children who may have contacted the infection and will subsequently serve as the source of spreading it.
What about the assembly of people, for example, in cinema halls or in our usual crowded markets? Just off the top of my head, Karol Bagh comes to mind, where you've got foreigners, you've got our own people, or Sarojini Nagar market in Delhi. What happens there? What should people do?
So, unless the picture becomes clear, I would say especially those who have symptoms should avoid going to crowded places, avoid markets if you can, because currently we are not sure if there is anyone who has symptoms, has been missed in the surveillance, and who is, if he is going to a market and is coughing there, then he could actually serve as a source of giving the infection to a large number of people. So, for the next few days, it would be advisable to avoid going to a lot of crowded places. You mentioned Karol Bagh, it could be even while celebrating Holi that one needs to be careful, because we are at a point where the number of cases has increased, but has not really shot up as has happened in other countries.
Doctor, the point on Holi, do you believe that citizens should not celebrate Holi? The Prime Minister has already said that, he's going to stay away. Is that a strong message from you as well as a doctor, that just avoid this to cut down on the possibility of infections?
So, I would say you should celebrate Holi, but do not do it in like a mass gathering or in a big crowd, because their chances of spreading an infection are much more. And if you are sort of putting paint or the rangoli on someone's face, and if you have the infection on your hands, then you can transmit it to a number of people just by applying color on the head and the face. So, one should be a little careful as far as celebrating Holi is concerned, especially when we have an outbreak which is gradually increasing in Delhi.
Just one or two more questions. If you look at the numbers in China, there are an increase. There appears to be a trend in the last 3 to 4 days of recoveries increasing and new cases going down. Is it possible to say that given this trend, it's possible that we would see this in other countries as well, or does it depend on the healthcare system of every country?
So, it depends on two things: the healthcare system and how quickly you can prevent the chain of spread. What China did was it had a total lockdown. It did not allow any of its citizens to go out, and therefore did not allow the infection to spread to other parts of the country. And gradually they are now seeing the benefits that there has been a decrease in the number of cases. If one is able to do that with a good surveillance system, a good health backup, then one will be able to prevent the spread of infection. If you look at what happened during the SARS outbreak in 2002-2003, the outbreak stopped not because of any drugs or any vaccine. It stopped because one was able to contain the infection and prevent the chain of spread, and gradually the number of cases decreased and we were able to get rid of SARS at that point in time.
And my final question to you, lots of people watching this, we'll be repeating this later on in our bulletins. What is your message to citizens? What do they need to do to stay safe?
So, I think 2 or 3 things. One is not to panic. Second is that if you are going to a crowded places, try and avoid it for the next few days, but if you do have to go, you could wear a mask. Regular hand washing is very important, because that is one of the ways that the infection can spread to you. And the other very important thing is that if you have fever, cough, cold, and you come in contact with a person who is diagnosed to have coronavirus, or you have travelled in the last 14 days to any of the countries where there has been a big outbreak, do report to the health authorities, and if they ask you to be quarantined, do get quarantined, because you could actually prevent an outbreak occurring in India.
Dr. Randeep Guleria, the Director of the All India Institute of Medical Sciences, a pleasure speaking to you. Thank you so much for sharing all of those critical points. Thanks very much indeed.